Salam and welcome to A Little Push, 5 Minutes Medical Mnemonics.
All right, let's jump right into a clinical puzzle. Imagine a patient comes in with kidney stones, they're complaining of bone pain, they're constipated, and they just seem confused. I mean, these symptoms seem all over the place, right? What single problem could possibly link all of them together? Well, the answer is hypercalcemia, too much calcium in the blood.
And this is the little rhyme that's going to stick in your head forever and help you remember that clinical picture. It is one of the all-time greats in medicine because it's so simple, it's catchy, and it perfectly sums up everything that goes wrong when calcium levels get too high. Let's dig into what it really means.
So let's translate this. Stones, well, that's pretty direct. We're talking kidney stones, because the kidneys are working overtime to filter out all that extra calcium. Bones refers to the bone pain and even fractures that can happen when calcium is being pulled out of the skeleton. Groans covers all the tummy troubles, constipation, abdominal pain, even pancreatitis. And last but not least, psychiatric overtones captures the brain effects, which can range from just feeling tired and lethargic all the way to serious confusion and psychosis.
So you've recognized the symptoms. That's a huge first step. But now comes the really tough part, figuring out why. The list of things that can cause high calcium is just long and honestly a little overwhelming. How are you supposed to remember all of that, especially when you're under pressure? You need a master key.
And here it is. Your master key is the word chimpanzees. This one single mnemonic is going to be your best friend. It gives you a systematic way to run through all the major causes of hypercalcemia so you never miss a thing.
But wait, before we break down the whole mnemonic, let me give you an absolutely critical, high-yield tip. Seriously, this is gold for your exams and your rotations. The most common cause really depends on where you see the patient. If they're in an outpatient clinic, your number one suspect should be hyperparathyroidism. But if the patient is already in the hospital, you have to think malignancy first. Knowing that distinction is a game changer.
All right, you ready? Let's start cracking the code. We'll begin with the first 4 letters of chimpanzees, C-H-I-M. These are what I like to call the heavy hitters, some of the most common causes you're going to see. Let's run through them. C is for calcium supplementation. Simple enough, right? Someone's just taking in way too much calcium. H is for hyperparathyroidism, our classic outpatient cause. But don't forget it can also stand for hyperthyroidism. I covers both immobility, think about ICU patients on bed rest, and iatrogenic causes, meaning drug-induced. The classic drug you have to know here, thiazide diuretics. They make the kidneys hold on to more calcium. And M stands for metastasis to the bone and milk alkali syndrome, which you see in people taking tons of calcium carbonate antacids.
Okay, halfway through our chimpanzee. Now we're diving into the second half, pansies. This is where things get a bit more complex, touching on different glands, growths, and some really cool pathophysiology with granulomas.
So, P is for Paget's disease of the bone, a condition where bone remodeling goes haywire. A actually pulls double duty for 2 endocrine disorders, Addison's disease and acromegaly. And N is for neoplasm. Now hold on, didn't we already talk about cancer with M for metastasis? Yes, but N is for cancers that raise calcium through other mechanisms, which is super interesting.
This is so important because it shows the different sneaky ways cancer can do this. For example, squamous cell carcinomas can produce something called PTH-related peptide, or PTHrP, which basically acts just like parathyroid hormone. Then you have multiple myeloma, which causes bone to break down directly. And some lymphomas can actually start producing active vitamin D themselves, which is a mechanism we're about to see again.
We're on the home stretch now. Z is for Zollinger-Ellison syndrome, but with a little asterisk. It's specifically when it's part of the MEN1 syndrome. The 2 E's are pretty easy, excessive vitamin D and excessive vitamin A. And finally, we land on S for sarcoidosis and other diseases like it, such as tuberculosis. The way these diseases cause high calcium is totally unique and really important to get.
So what is going on with sarcoidosis? In these diseases, the body forms these little clumps of immune cells called granulomas. And here's the key. The macrophage cells inside these granulomas basically go rogue. They gain the ability to activate vitamin D, a job that's normally handled carefully by the kidneys. This leads to way too much active vitamin D floating around, which then causes the gut to absorb a ton of calcium.
And there you have it. Amazing job. You now have the complete toolkit. Just remember stones, bones, groans, and psychiatric overtones for the symptoms and chimpanzees for the causes, and you'll be set to tackle any case of hypercalcemia that comes your way. So what should we cover next? Is there a topic that always trips you up or another high-yield mnemonic you want us to explain in 5 minutes? Drop a comment below and let us know. We really do read them all.
Until next time, salam.